will send you a link to the recording when it is finished rendering through Zoom so that you'll be able to share this recording with your colleagues who were perhaps not able to join us today. We also want you to know though that we are recording, so don't say anything crazy that you don't want the rest of the world to hear. Make sure to mute your phone, please, when you're not speaking. You can press the mute button on your handheld handset, or you can press *6 to mute and then *6 again to unmute. Please don't put us on hold. Sometimes people are unaware because they don't put themselves on hold that they actually have music as part of their hold button. And we will hear that if you do. So please don't put us on hold. Please put us on mute. Please don't use a speakerphone if at all possible when you're asking questions. Obviously, if you're in a room with more than one colleague and you're listening by speakerphone, that's fine. But make sure you put us on mute so that we don't pick up background noise. And if you're going to ask a question, if you're going to use the audio, please use the handheld so that we can all hear you clearly. Participation is essential, as is always true for our state team collaborations and our network collaborations together. So we'll look forward to your questions and your comments as time goes by. If you have any technical issues with getting onto Zoom or hearing anything, please go ahead and send a private chat to Libby, and she will do her best to help you with your technical problem. If you have content questions, though, if you have questions for the presenters or questions of your other colleagues who may be on the line, please make chat box to everyone. If you're using phone audio, please take a minute now to link your phone on your computer. This is especially helpful to us. If we go into breakout rooms later, it'll be easier for us to identify you by your name to put you in the right breakout room than trying to figure out where you're calling from with just your phone number. Next slide, please. For those of you who are not 100% sure how to link your computer and your phone, these are the instructions. If you enter your participant ID, it can bind your phone and the computer together just by using your phone. I think that, again, this is really helpful to us if we move to breakouts later. It's just going to help make the whole process of going to breakouts faster and more efficient. So thank you for taking the minute to do that for us. Next slide, please. So welcome. As I said, we're really excited to be introducing a new tool to you, and it is literally hot off the press. We'll allow our presenters to go into more detail around it, but I wanted to say a special thank you to Beth Goretsky from Family Voices and Mary Jo Palladino from Family Voices for joining us today and presenting on this tool that they've been working on for some time, along with our partner, Kara Coleman. I want to just take a moment and see if our project officer, Anna Maria Padlin, has had a chance to join us today, and if she would like to just say a few words of welcome to you all. Anna Maria? Anna Maria, it's possible if you're with us and speaking, you might be on mute. If you could just double check your line.
Anna Maria, I just unmuted you.
Can you hear me?
There we are. Hi, Anna Maria. Welcome.
Okay. Hi. Okay. I think because my phone actually got linked to the Zoom, I had unmuted my phone, but you still couldn't hear me.
Thank you for your patience.
Okay. So thank you very much, Meg, for that introduction. And I want to echo your thank you to Family Voices for presenting this tool today, for allowing us to, for HRSA to introduce it to the other COIN teams. And also thank you to the medical complexity COIN teams for allowing us to share this time with you, to be on the public portion of this webinar, which is just for the first hour. But I know that other MCHB COINs, other DSHN programs are really interested in family engagement and how to bring that into our programs. And the medical complexity COIN has been really good about engaging families on all the different levels, bringing them on the state teams, on the National Advisory Committee, having them lead the family focus groups. And so everything that we can learn from this COIN, you know, we want to be able to share with the other COINs. So thank you again for the opportunity to open it up to other addition programs and the other coins. So thank you very much.
It's really our pleasure, and I know that Family Voices folks share the same sentiment, Anna Maria.
Yeah, thank you.
Thank you. Let's switch to the next slide now. We'll do a quick overview of the agenda, and then we're going to turn the floor over to our colleagues from Family Voices. So we've already been through our welcome and housekeeping. We're going to have an introduction to the Family Engagement in Systems Assessment Tool, or FESAT. That'll take about 45 minutes with our Family Voices speakers. Then, if there aren't an overwhelming number of questions for the Family Voices folks that we want to continue with, we'll switch to state team breakouts for 20 minutes and then come back and do some group sharing. If it turns out that there are still lots and lots of questions after the Family Voices folks are finished presenting, we'll go ahead and we'll continue that conversation and put off the breakout work that we were planning to do for a little while for another opportunity. Finally, we'll do a wrap up and next steps, and you all will get a link to an evaluation. And let me stress once again that we really do use that evaluation information to improve future webinars and future work on behalf of the Children with Medical Complexity coin. So please, please, please take an opportunity to fill that evaluation out. And I think that, Ben, if you can help me remember, before the folks who are with the other coins and HRSA, they may go away after the first hour. If we could post the evaluation link for them then, before we're finished with our entire webinar, then we'll be able to get their input as well. With that, I am happy to turn the floor over now to Beth Dworetsky and Mary Jo Palladino, who will speak to us about the FESAT and then entertain your questions on it specifically. Thank you.
Hi guys, good afternoon. It's Kara Coleman calling and talking. I'm just going to insert myself for 1 second before I hand it over to the true experts of this FESAT tool. Mary Jo and Beth and several other people at Family Voices have almost literally given birth to this thing. Many pilots, a lot of work, a lot of gathering of information, trying to craft a wonderful tool that is the first of its kind to be able to engage or measure, or sorry, not even the right word, assess family engagement in systems. And because this is brand new, although there have been pilots and other things, it's going to be a little bit different, I think, to use for the coin. So I just want to say up front here, you're going to hear right now from Beth, the expert, and if we don't get to all the questions, she will provide written answers. And Mary Jo and I will be available next week during office hours and any other sort of other customized interaction, communication to make sure that we put together the right teams and the right statements to get us started. But I really think that the webinar today will help answer questions. So I just want to encourage, although it's been really emphasized here in the beginning, those technical questions go into chat for Libby. But all the content questions, as soon as you have them, put them in that chat box. Mary Jo and Beth are going to be tag teaming the presentation, but Mary Jo and Beth are also going to be tag teaming and infusing in the questions so that we can be answering and not move through the tool if there's still a lot of questions on particular topics. And then I'll be kind of watching how we're doing with questions to decide, do we want to stay discussing these questions or go ahead into breakout and team time? So without further ado, Beth and Mary Jo, please help us, teach us, and ready, go.
So good afternoon or good morning, depending on your time zone. This is Beth. And thanks to Meg and your team for inviting us, and thank you, Kara, for that introduction. Just by way of reminder, Family Voices is a national family-led organization of families of children and youth with special health care needs and disabilities and professional partners. For more than 27 years, we've worked to keep families at the center of children's health care by promoting collaborations with families at all levels of health care, ranging from individual family provider partnerships to family professional and family-led organization agency partnerships at systems and decision-making levels in order to improve healthcare services and policies for all children. And it's home to the Maternal and Child Health Bureau funded Leadership and Family Professional Partnerships Project project, we are the technical assistance provider to the provider for the family-to-family health information centers in each state, 5 territories, and 3 tribal nations. And we work to encourage, support, and strengthen family engagement across all systems of care. So from your team compositions, I was really pleased to see that many of the COIN state teams are already connected with the Family Voices folks in your state. And if you're not, or just if you want to know more about us and our projects and resources, please visit the website or speak with Kara or Mary Jo. And I know that we all know this, about the different levels of care, but this slide is here for the express purpose of stressing that the Family Engagement and Systems Assessment Tool, or FESAT as we call it, is to be used for assessing systems level initiatives. And in the spirit of nothing about us without us, we believe it's critical to include the voices of individuals, families, and communities who will be affected by policies in the development of those policies. So patient and family engagement at all levels of healthcare, particularly systems level, is not a new concept. In 1987, Surgeon General Koop's Surgeon General Report on Children with Special Healthcare Needs proposed action steps towards achieving comprehensive, coordinated, family-centered, community-based services for children with special healthcare needs and their families. And these steps included the facilitation of parent-professional collaboration at all levels of healthcare between the child, family, and provider, in program development, implementation, and evaluation, and in policy formulation. And this applies to everyone, not just children, not just individuals with disabilities. The whole nothing about us without us applies to the elderly, LGBTQ+ populations. Recognition of the importance of nothing about us without us is built into the 6 pillars of learning for nursing. So, and in addition to that, there is an increasing expectation for family engagement and systems level initiatives, much like the work that you are doing, that the COIN teams are doing with family leaders as partners in your efforts specific to the CMC COIN to improve quality of life and family well-being and cost-effectiveness of care as part of the goals of this COIN. So there really were no tools for assessing family engagement and systems level initiatives other than process measures like numbers of families at meetings or numbers of responses to surveys. So the need for so we sort of took the need for assessing family engagement to heart and tried to figure out a way to assess it in systems level activities. And so we're particularly pleased to have the opportunity to introduce the tool to you here today. Mary Jo?
So, hi everybody. So systems level family engagement. The definition that we use is authentic partnership between professionals and family leaders who reflect the diversity of the communities they represent, working together at the systems level to develop and implement better policies and practices. So with that in mind, I would ask you, use the chat box and give us examples of systems level work that you may have been doing. Feel free to just enter in the chat box. What work may you be involved in now, or initiatives that you may have worked on? Oh, could we move back to the definition slide? Partnerships between professionals and families that reflect the diversity of the community. working together at a systems level. Okay, we have an example from Allison Martin, exploring payment option for a transfer of care. Tammy Bakewell gave an example, working with our state emergency planners to ensure that families of children with disability are helping design reunification plans after a major earthquake. Okay, we have a few examples. Beth. Title V program engages a family-led organization in the planning and implementation of Title V needs assessment and related block grant development. Medicaid example, Medicaid engaging family leaders to identify barriers to services and works together to improve policy. Hospital example, Families in a Quality Improvement Initiative evaluate the discharge planning process. And we use the Texas CMC coin example, the team engaging families as part of a stakeholder collaboration to transform workflows into an integrated care delivery model that provides family-driven care, optimizes patient and family satisfaction, and improves healthcare outcomes. We have another example that came in the chat box, Regional Genetics Network Family Leadership Group. Colorado example, Angie Goodyer submitted. Colorado has family leaders actively participating in their advisory team. They provide feedback and feed forward and respond to potential solutions, policy changes presented at meetings. Good examples. Okay, next slide. The framework for family engagement is outlined in the issue brief that we sent ahead of the webinar, and I believe was posted to the chat box where you can download it. So the tool, the FESAT assessment, was developed around the framework that's outlined in the issue brief. And thank you, Kara, for sending that out in advance. This provides context for assessing family engagement and system change. There are 3 products. The tool itself, which we refer to as the FESAT, or the Family Engagement and Systems Assessment Tool. Then there's a user guide that explains the process and how to score the tool. And then there's an accompanying toolkit that again follows the same framework and the 4 domains. So a little bit more about those. The user guide has several sections. So evidence that family engagement and family healthcare initiatives leads to improved health policies, which leads to increased patient safety and improved health outcomes. We also know it's hard work to engage families in policy work, not because they can't do it, but because the information and supports they need to make a meaningful contribution are not always present, leaving families feeling like a checkbox to fill an expectation or a requirement to have a family member present, but without a real clear role. Based on the literature review and the key informant interviews that we did, we identified criteria that support meaningful family engagement in system level initiatives. So the user guide includes not only an introduction and instructions, but in how to score the results, a section on identifying ways to use your results. There's some example uses, and in the last appendix, a definition of terms. So the FESAT is based on the 4 domains: commitment, transparency, representation, and impact. The tool itself is organized around those 4 domains, which we had identified again in the issue brief. The toolkit, these next few slides, I'll give you a picture of how the toolkit is put together. They're divided into the 4 domains. You'll see a definition of that domain at the top, and then there will be boxes that describe strategies. And then following each strategy, there will be resource examples. So in this slide, you see 3 bullets, 3 examples of resources that one can connect to. So this is commitment. This next slide is transparency. You'll see a couple boxes there, 2 different strategies. And again, following each strategy, there are resources that you can access. And then in the next slide, representation. Again, you see the block for this that outlines the strategy. And then under resources, in this particular example, there's some internal data sources and some external data sources, and then those are bulleted. And in the next slide, this is impact, the domain impact. There are 3 strategies here, and again, you can see resources listed under each strategy.
Mary Jo,
Yes.
there are some folks that would be helpful to be able to see your lips, to be able to, we just want to make sure everyone can follow along. And we can't see you right now.
Oh. Can that be changed?
Okay, I think that is from your end. I'm going to take a look and just double check. Apologize to everyone. There you go.
My video is on.
Yep, it's working now.
Can you see me?
Yep, now we
Okay,
can
great.
see you.
Great. Okay, and so we went through the 4 domains in the toolkit. So on the next slide, there's a checklist in the toolkit. And this is, I don't know if you can read above the table are the instructions to use this. This is a tool that you can use as you're beginning an initiative to go through and look at what you may have in place currently, and then other areas where you might want to consider adding it before you do your initiative. Okay, so those are the components of the toolkit. So now we come to the FESAT itself, the Family Engagement and Systems Assessment Tool. And there are 3 ways that this can be used. one of assessment or assessing how well an organization engages families. Another way to look at it is improving areas of family engagement. So looking at efforts over time towards meaningful family engagement. And then the third way is to guide the work, to guide the design of systems level activities to ensure family engagement. So for purposes of the CMC coin, we're talking about an ongoing work assessing how well organizations engages families. And so now I'm going to turn it over to Beth, excuse me, and Beth is going to go through in more detail the process of using the FESAT.
So thanks, Mary Jo. And I
You're
also
welcome.
just wanted to make clear that the screenshots that Mary Jo shared about the toolkit is not the entire toolkit. That was just a screenshot. It's a little, so that there are several, there's more than like 2 or 3 strategies in each one of the domains. So I'm going to go back a slide just because here Mary Jo explained that this is a tool to be used for systems level initiatives, and it's to see how well an organization provides the support, the information, and the information to engage families. And so when we said, I wanted to go back just to pick up on that word organization. And so to note the use of the word organization in the previous slide, because for using the FESAT, the organization is the actual entity that is engaging the family or youth leaders in the work. So in the case of the CMC coin, the FESAT will assess how well family or youth leaders, if you have youth leaders on your team, we included that because I was told at least one of the teams has youth leaders, but you'll use the FESAT to assess how well family or youth leaders are being engaged in the work to test and spread promising care delivery strategies and payment models to improve quality of life, family well-being, and cost-effectiveness of care for children with medical complexity. So for the purpose of using the FESAT, your COIN teams, even though they represent a team of people from across multiple systems of care, are the organization. So basically, is the organization your multidisciplinary team of professionals? How are they providing the support family and youth leaders might need to participate and partner in these activities to their maximum potential? So,
Mary Jo, I just want to say that in chat we had a shout out to something you were saying. Trisha Brisbane says, so important to point out the star and description of family leader. Thank you. A family leader truly represents the voices of many families, not just their own.
That was yes. And I wanted to say that, this is Beth, sorry, that definition of family leader is the definition in the user guide. The last page of the user guide has a couple of definitions, just to make that clear. So thanks, Trisha. So this is what the actual tool looks like. Again, as Mary Jo said, it's organized by domain, the same way that the toolkit is organized. And there's a scale of responses that people can choose. If you're not sure, in some cases, some of the items will not apply to your initiative, in which case it doesn't apply. And sometimes you just won't know the answers to the questions, and so you will not score things that you are not sure about, or that you don't have all of the information that you need to respond to the item. Family leaders and professional partners both score the same tool. So everyone responds to the items in the FESAT based on his or her own experience. And again, the purpose is to assess if family and youth leaders are participating as partners in the initiative, have the information and supports they need to contribute to the work, and have the information and supports they need to contribute to the work in a meaningful way. So for example, in our research to develop the tool, family leaders and professionals noted the importance of having at least one or more organizational champions to set an example and sort of like sound the horn for the importance of engaging families in the work. Another thing that was important was having a written policy that requires family engagement, so that there's actual rules of the game for ensuring that families are not only invited to participate, but also provided with any needed support. And for this domain, you will generally the 5 items in this domain apply to the organization as a whole, not necessarily the specific initiative. And this again is a repeat of the screenshot of the 5 items in the commitment domain, but I wanted to line it to show you a side-by-side with the screenshot from the toolkit so that you could see how the items in each domain can be supported with strategies and resources in the toolkit. And there is some crossover between it where we sort of refer people back and forth, because clearly a strategy that works in one domain can work in another domain. But so just to let you know how it was organized. These are the items in the transparency domain. And again, for the other 3 domains, transparency, representation, and impact, you will, we ask people to respond based in the context of the specific initiative that you are assessing. And in this case, how families were engaged in the work that you are doing on your individual state team.
Hey, Beth, this is Kara. Can I share a couple questions from the chat box with you?
Yes.
So one is from Trisha from Minnesota. She's asking, just to clarify, you said we are not NOT to score something if we don't have the information. Is that correct?
So like sometimes, so we'll just take something from the slide that's here. The organization conducted activities to understand the issues faced by children and families they serve. For example, used data or conducted a focus group. So sometimes not everybody on the team will know that if that happened or not. So you don't have so you don't know. And if you don't know, then you're not sure about whether the organization actually used data to understand the issues at hand. So you would be not sure, but which raises the question that if you're not sure, why aren't you sure, and should you be sure? So for things, I'll address this later when I show you the score sheet, but there are some things that you just may not know about the initiative. And no judgment, I'm not saying that that's like good or bad. It's just, and I also know that sometimes that over the course of the 2 years so far that you have been working on your teams, that there has been some changeover in the team. So certainly not all team members have all of the background to know everything that went on before as they join the project. So that's why we're allowing for the fact that not everybody knows everything about what went into the planning of the initiative. Does that answer the question?
I think so, but I'll ask Trisha if you have, oh, there you go. She said yes, thank you. And I've got one other question for you, Beth, as well, that might require a little backtracking. It's from Paula in Washington, and she asks, how does this adapt? And by this, I assume, Paula, you're meaning the FESAT tool itself, adapt in a collaborative rather than a single organization? Or by this, do you mean the scoring? and the tool itself. Maybe you can clarify what your this is, or perhaps Beth, you understand the question to be able to go ahead and answer without clarification. Do you want me to read the question again without my interrupting? Sorry. Apologies to everyone. How does this adapt in a collaborative rather than a single organization?
Well, okay, so that's why that was the purpose of this slide. So apologies if I wasn't clear enough. The organization in this case is going to be the multidisciplinary team, or the because your teams are made up of a collaboration of a vast array of health systems, like departments of health, Title V programs, Medicaid, children's hospitals, and other health systems, as well as family members and family-led organizations. So in this case, when you think about the organization, the organization items, the items that ask about how an organization, about what an organization did, you will think of that collaborative team as the organization, and how you work together to come up with the initiative that you propose that advances the goals, the overarching goals of the Children with Medical Complexity coin.
So you got a response from Paula saying she didn't understand that. Thanks for clarifying. And then actually somebody, Allison Martin from Oregon, had chimed in a similar sort of question earlier, and she said that revisiting that slide right there helped.
Oh, great.
And Meg is just clarifying, the organization that Beth is referring to is your state's multidisciplinary team, not all 10 states. That's a great clarification as well, Meg. Thanks.
Right. And let me double check. Bear with me while I move backwards. So you will have copies of these slides, and so whoops, sorry about that. So as a reminder, you will have something in print to remind you of that as well on this slide. I don't know if you can see my pointer, but anyway, the third bullet actually calls out that it's a state team. And I will also say that Kara and Mary Jo, who participate on your calls, and I am also very happy to answer any questions about the use of the tool at any time, even as you go along. You should always feel free to reach out for assistance, because we don't want people to be frustrated. We want it to work, and what we learn, and if there are problems with using it, what we learn from your experience, even though we did a lot of pilots and we learned a lot, what we learned from your experience actually using it in the field will help inform our work and improve it moving forward. So these are the items in the representation domain, and I'll actually give you a I'll take a few extra minutes just to point out that this is a place where you might not sure or not applicable, but here in the directions, we specifically called out that the family leaders who collaborated in the initiative were representative of, because we are aware, not so much in the coins, but sometimes for Title V programs, that they have specific initiatives to serve specific populations. Like a lot of the Title V programs are working to improve infant and maternal mortality for women of color. And so in that case, you would answer this, you would respond to item 11, races and ethnicities of the population served by the initiative. Were the families who participated in the initiative representative of the population being served, so that it's around the specific initiative, because if it wasn't around the specific initiative, Title V programs serve all races and ethnicities of the population. And so it would, but if it's only Black women, then you can actually say, yes, we included all races and ethnicities of the population served because the initiative was for women of color.
Hey, Beth, I have a really astute clarifying question from Kendall in Texas, and she's asking, should we answer the tool based on what we have done in our COIN team only, or include interventions and policy that we may have developed prior to beginning the COIN, so aside from the COIN?
It's specific to what you are doing on your COIN initiative.
Thank you.
Okay. And these are the items in the impact domain. There are just 20 items in the entire tool. And so that's basically what the actual tool looks like. There are some things, there is some information that's really important to include, to sort of like set up before you begin the process of actually using the tool. And that is to identify the organization and your role in the systems level initiative, if you're a family leader or a youth leader or an organizational staff person. And remember that the organization is the entity that has engaged the family leaders in the systems level initiative. So the organization staff could be the individuals responsible for family engagement. They could be, or for an advisory committee, or for external relationships, or for policy making within the organization, but basically the people that were involved in doing the actual work. And the family and youth leaders could be those currently participating on an advisory committee if you have them, as partners in the quality improvement initiatives that you're working on, as members of a learning collaborative, or other policy, program, practice, or service initiative. And
Hey, Beth.
Yes.
Sorry, it's Kara. Is
Nope.
it okay now
Hi,
to?
Kara.
Okay, time to interject another question that I apologize. I'm not
There's
sure.
always time for questions.
Questions, good. Yeah, and I missed it earlier, and Beth Lynn kindly helped prompt me on it. So I apologize for missing it earlier. It's asking, are questions 7 through 10 just to be answered by family leaders as opposed to healthcare team members, or should healthcare team members answer these questions based on their perception of what has been provided to families? Great question.
Excellent, and sorry I missed that.
No, my apologies.
This is the same tool that both the organization staff and the family leaders answer, and everybody answers within about their own experience. So everyone completes the same tool from their own experience, but some of them actually ask if like for domain 4 for input, for impact, if the organization staff listen to their idea. But organization staff can also say, did we listen to family leaders' ideas? Did we engage family leaders in choosing the goals? So all of the items were created so that they could be answered from the perspectives of both like the agency, organization, systems level folks, and the family or youth leaders.
Thank you. Oops, we've got another one. Sorry. Thank you, Paula. I'm not going to miss this one. All right. Is there guidance about scaling? For example, what does sometimes versus usually mean? Should we align as a team, or is everyone to use their own internal scale?
You can use your own internal scale for sure, or if you want to create it's hard to create a scale for others to use, but if you want to say like never means 0% of the time, rarely it's 5% of the time, or if you want to like actually give percent, that's fine too. But the other thing is, it is from each individual's perspective, and once everyone like completes the tool, you can either as a group discuss your responses, where you agreed, where you disagreed, and come to a consensus, or you can discuss your responses, or even complete the tool either as the family leaders together, and this works virtually too, because I know you're not all in the same place. You can discuss each item and score it and complete it either as like the family leaders, and then the other members of the team can also, you can complete it individually or as a group, so that you come to some sort of consensus. And then the organization folks and the family leader folks can sort of, we would ask that both groups meet and come to a consensus, and then you can actually score the tool. So we didn't want to be too prescriptive about how that happens. The user's guide does give examples of how you can use the tool, but we also think that it is flexible enough that people can use it any way they want, to as a conversation starter, to see if families feel like they really had the support that they needed in order to participate to their maximum potential. So one of the things that came up in our literature review and in I'm trying to be mindful of the time, but in the interviews and in interviews we did and in the literature search, is that it's really important to provide some sort of compensation for families who participate in these kinds of activities. One, it recognizes their time and their expertise, but it also levels the playing field, because there are costs associated with taking time to participate in these kinds of initiatives. And so not everyone has the luxury to say, yes, I can take the time, or I can travel, or I can do any pre-work or follow-up work required in order to make a meaningful contribution to this. So that's sort of like an equity issue that levels the playing field. So that's how we developed the items, and how we wanted to try. And also there are other supports that families need, like they may need things in multiple languages. It's really important to use plain language, and strategies and resources for this are all included in the toolkit. That after groups complete the tool and sort of see how they're doing in each of the domains, that they can say, gee, this is an area of strength, well done, but maybe there may also be some areas where you can improve. And so you can use the toolkit or come up with strategies and resources on your own. We would hope that the toolkit might be able to be a starting point and help you do that, so that there are some things that you can implement in order to improve family engagement across all 4 domains. And that would be a way. So my understanding is that you're using this tool to assess family engagement over time, so that the first time you use it, your scores, which are not a measure, it's just a relative score, would be the baseline. And then as you move along in the work, you might build in some additional supports or things that family leaders identify that they need. And then when you do it again, you would compare the new scores to the old score, to the original scores, and see if indeed, what you've implemented has helped ensure, support, and strengthen how family leaders were engaged in this work.
Hey, Beth, I know you just mentioned you wanted to be cognizant of time, and that's fine, but I also want to encourage you to just keep going, because you have a lot more to still share and teach. So you are fine to just keep it moving too.
All right, and then please keep piping in with questions because I don't want people, I don't want to keep moving forward and have unanswered things frustrate anyone. So as I said, there's some before you begin stuff to sort of clarify. Ooh,
Beth?
have I lost the connection?
Yes, your connection got lost. So maybe we should try to share.
Yeah, I'm really sorry. I don't know what's
Okay.
going on with my computer.
I can try to share the presentation from my computer.
Do you want to
would
do
be
that or
great.
do you want
Thank
me
you.
to do?
If you can do it right now, you're welcome to do that. And then if you can get
Well-
back on, Beth, great, but I think it's more important that you're able to continue speaking. It is helpful to be able to see you, but if that's not possible.
Sorry.
Right. And
I,
Beth, while we're trying to connect,
You're back.
there was another question about whether we could share now the document with all the questions. And we don't have that right now, but you will receive that after the webinar.
Oops, Beth, 1 second. You are muted. Wait, I'm gonna unmute you. There you go. Go ahead.
okay, thank you. Okay, so yes, we're gonna we will send the tool, the user's guide, the toolkit, and the score sheet out to I don't know. I was going to let Kara work that out. If Kara should just send you the tools and you put them in the box,
Yeah.
or however you want to do it. But
We're going to do a personalized approach to each of the teams. And then also, of course, everything is up there in the lovely box. So we will do both.
And
okay.
Do
are you
I
gonna
need
be
to
able-
share my screen? Beth, are you able to share your screen or should I go ahead and share mine?
I don't know where I am. I don't think I'm connected anymore. Is that it?
Correct.
We are able to see you.
Oh, can you see my screen?
Why don't you try sharing your screen and see what happens? Can you do that? If that's not working for you, it seems, oh, yeah, there you go.
That was me. So I'll
Okay.
just go ahead and advance. And then Beth, if you can tell me.
I'm on slide 23.
Okay. I'm not seeing numbers. So if you can just tell me when to
Oh.
stop. Oh, no, I am. Okay. Sorry.
Okay.
There we go.
So it should say before you begin, and we ask people just to sort of identify the organization. So we're picking on Texas, but that was one of the first ones that was shared with me. So that's why we use Texas, because we thought it was a really great example. So you would write in your state team, and then the next slide, Kara. And then also before you begin, you need staff and families should, organization staff or the representatives of your multidisciplinary teams and the family leaders or family and or youth leaders who participated in the initiative should write a short description of the ongoing or recently completed systems level policy, program, practice, or service initiative in which you were engaged. So there's a box in the tool, which you'll see, and it's sort of like the organization, the name of your CMC state COIN team engages or engaged families or family leaders in, and then you put in a short description of the initiative and then whatever the intended outcome is. And so if you go to the next slide, Kara.
Hold on one
what that
second.
was.
Okay, I'll go ahead to the next one, but then we also have a couple questions to backtrack
Okay. So just to finish this,
on.
when that's filled in, that's an example of what that would look like. So what's the question?
So the question is referring to hoping to get, have a look at all of the questions at once. Mary is asking, saying that she's still a little confused about the questions 7 through 10 since they use the word I. She's assuming that the desire is to understand the family's experience, not me as an operational staff member.
No, it's to understand both of your experiences. So, like if you're an organizational staff member, do you think you? Let me see. I want to go back and give an existing. I'm sorry. Did you say 7 through 10?
Yes.
Yeah. So as an organizational staff member, did you have a clear understanding of the initiative that you and families were working on together? Did you have the supports you needed to understand your partnership role? Because a lot of times people, staff people are assigned, hey, we're going to do family engagement, but they don't really have a full understanding of what they might need. Did you have all the information you needed to participate? These all also pertain to staff people. And one of the most important is, did you have the supports you needed to participate as far as physical access, interpreters, or time away from your other work responsibilities? Because a lot of times this is just an add-on and nobody's budgeted either funding or time to take on additional roles. And we understand that this takes time. It's intentional. It's part of all of the other work responsibilities you have.
Great. Yep, that was super helpful, Beth. So we're ready to go on.
Okay. So where are we now?
So we went to this, but I interrupted. I don't know if there's anything else.
So now you're on slide 25 that sort of explained like how you would fill out the description. And then the next slide, who scores the tool? Organization and the people who score it are the organization and family leaders who are engaging in the specific initiative. So for example, the CMC COIN state team staff, family or youth leaders who are participating in the initiative. Now I do understand that there have been some changes in your team composition, both agency, staff, family, and youth leaders. The tool should, if possible, the tool should be completed by individuals who have been involved in the work long enough to have an understanding of how families and youth have been and are continuing to be engaged in the design and planning of your team's specific initiatives, and to have an understanding of how the family and youth leaders have been contributing to the work to date. So that may not be possible on some of your teams, because I do understand, people change jobs, people take on other responsibilities, and that there has been some turnover, but that is the intent, is that people should really have some familiarity with the work that has been done in order to be able to respond to the item. And then after you score the tool, each participant group you can do it by group, or like by family leaders, or just by staff, or your whole group can discuss similarities and differences in responses and come to a shared understanding, and if possible, a consensus response for each item, and then you can complete a score sheet. My understanding from Kara is that right now you've been working on initiatives that you haven't really gotten to the implementation stage. So what you'll be assessing is the work up to this point, the 2 years of planning that you have done so far. And so I'm not really sure what to do now, because I wanted to show you this. These are the steps that I was describing. Kara, the next slide should have consensus scores.
Yep.
I feel like I'm working blind here. Consensus scores, and which would describe what I had just said. And then there is a score sheet, and this is a screenshot of the score sheet. And
The next one is? Yep.
oh, wait a minute. Can you stop sharing, Kara?
Sure.
And let me see if I can. Okay. Whoops. Have I totally disconnected myself?
No, you're still there.
Okay. I want to share my screen, but I don't see the option for doing that.
So if you go to the bottom, if you hover your mouse over the bottom of your screen, a control bar pops up.
Oh, I wasn't.
It could be
It is
sometimes,
not. Yeah, it's not letting me see the control bar.
it might be at the top is the other option.
No, I
because-
see it. Yeah.
And then
Okay,
it
wait.
says share. Yeah.
Sorry, guys. Beth was just really wanting to be able to show she had queued up something in to be able to show you live how to do the scoring and how it tabulates and stuff for you. So if you can bear with us just for another minute to see if she can share, otherwise we'll go back to my sharing.
Yeah,
see a score
There it
sheet?
is. Worth
Okay.
waiting for.
You did
I
it.
am really sorry. It's, when I live in southern Rhode Island. For some reason, when we've had a lot of rain, it totally screws up my internet, and I have no idea why. But anyway, so that was a screenshot. But once you come to your consensus scores, you can actually enter scores into the score sheet. And as you enter it in, it'll give you like a bar graph to let you know how you're doing in that domain. So the first one's commitment. Now, as I said, sometimes teams just don't know what kind of pre-work has happened before the initiative. So if there's something that you don't know, you can just leave it blank. And then it will not be factored into, it won't be factored into the total. It will be, instead of being computed on like 20 point, on 16 point, I'm sorry, 1, 2, 3, on the full point score of like 16, if there's something that you don't know the answer to or can't respond to, it'll be computed on a fewer number of points, because the maximum is 16. So as you work through the score sheet, you'll get a bar graph, and it will start computing an overall family engagement score that you can use as your baseline scores And you can also see, I mean, you haven't gotten to implementation yet, so you might not even be able to score this domain yet. So, so in this case, you might say, gee, maybe actually these scores are pretty good, so well done, teams. But if your scores were lower, you could say, gee, we've done really well in representation, but not so well in commitment. What can we do to be better? And then you could consult the toolkit and say, well, this is a specific strategy and some resource strategy that we could try, and here's some resources to give us some ideas for how we can improve. And so you can try that, and then whenever, whatever the time period is for, in your work plans for using the tool again, then you can score again and see if you've improved in one or more domains.
Beth, I've got a question for you.
Okay.
Does the tool combine, or the scoring sheet combine scores from the team and give it a blended overall score?
No, you have to come to a consensus on your own. So that you would, I mean, each group, you can use the score sheet any way you want, but our vision, our original thought process was, and again, we are very open to also learning about other ways that people might be using this tool, but the intention was that there would be a single team score that you reach a consensus on and enter into the score sheet. But if like the family or youth leaders wanted to score, and then the agency representative, you know, your agency representative wanted to score separately, and you could just have a visual comparison of the scores and see where you sort of agree, where you felt, and see where the similarities and differences are and how you are doing. You could do that too. It's, again, we didn't want to be overly prescriptive about how you use it. Our intention was that these are 20 items that we have identified through a literature review, through key informant interviews with both family leaders and with professional partners from a wide variety of fields, and our learnings from both cognitive testing and pilot testing across a variety of systems of care. These are the 20 things that like professionals and families care about the most for ensuring that family leaders have the supports that they need to not only partner, but to make meaningful contributions to systems level work.
I have a few more scoring questions for you, Beth.
Yep.
Well, first one's a comment from Paul. I'm not sure if everyone's looking in the chat box, but just to share it out loud. Representation, quote unquote, is a whole body of work in itself, particularly in smaller collaboratives such as this. I welcome the opportunity for a deeper discussion as we move forward. I think we all do. I hope we all do. Thanks, Paula, for sharing that. And then Allison from Oregon had a question. For questions that ask for individuals' perceptions/experiences, for example, as we were discussing earlier, questions 7 through 10, it sounds like we'll need to decide as a group how to come to a consensus, for example, averaging them in a way that is different from how we might think about organizational scores or organizational items.
You could average them, but they're part of it, as I said earlier, a lot of this is just to start the discussion about what's working and not working, about how family leaders and youth leaders feel supported in the work that they are in policy, decision-making work that they are doing. And so you can average it, or you can also, I think that there is some value in understanding, in hearing from everyone's different perspectives and coming to a consensus. And if consensus means average, then that works as well.
Thanks, Beth.
So it's 3:11. I'm really sorry I talked so much. Can you put the slides back, or maybe I can even do that?
Yeah, do you want to try, or I can? Go ahead.
Yeah, let me try. Oops.
So first, Beth, you stop sharing what you have.
Yep. Mm-hmm.
And then you share again, and it will show the different thumbnails of the possible open programs to share. You got it.
Okay, so
Beth,
using your results.
Sorry, before we move on, a couple people just commented that they're trying to think through how to combine their own personal perspectives as their own perspectives as an organizational staff member and a family's perspective. And then added to that, if the goal is to understand family perspective, we could just enter a family score and leave organization staff perspectives for internal discussion.
Yes, you absolutely could. You absolutely could. So, and that's what I said. So we have outlined some steps for using the tool, but have left it open enough for teams to be creative and use it the way that is most informative to them. And just please remember, this is a self-assessment tool. It can help, it can be useful, and I will tell you, the pilots all said that they found it useful for identifying domains of strength and domains where family engagement could be improved. If you're using it as a quality improvement, to sort of assess quality improvement, the initial scores, that's a typo, sorry about that. The initial scores serve as a baseline, and that you can compare subsequent uses to individual domain and/or overall family engagement scores. And you can use the toolkit to help choose strategies and find resources. And yes, you can certainly just have family leaders score the tool and use those findings to inform how to move forward. Although I would never, when in the development of it, we also wanted to include the staff perspective, because it's bi-directional learning, and also I don't know that staff always feel supported in their roles when they are sort of assigned family engagement activities, and we wanted to be respectful of that as well. And I will also say, this is not a feedback survey for you to complete now. But in all of the tools, in the user's guide, in the toolkit, we have included a feedback survey, because hopefully you will use this tool to inform your own learnings about family engagement, but your experience will inform our learning. And so we would really appreciate, not to confuse with any evaluation, Bethlyn, that you are going to do as part of this webinar, but in the tool, how you use it and your feedback will inform improvements that we make moving forward. So we'd appreciate that. If you have any questions at any time, we are always super happy to provide technical assistance. It can be customized, individualized, one-to-one assistance tailored to your team's project and needs. Kara, Mary Jo, and I, all together, individually, or all three of us, or two of us, or any configuration, will be happy to speak with representatives of your team or your entire team by phone, by email, by webinar. If you live in Hawaii, I will be there on the next plane. And really, because at this phase in our work, hopefully you will be willing ambassadors about helping us spread word about this, but we really want to focus on implementation and meaningful use, and we are here to help. And I didn't know if you were going to take time to do breakouts, but here were the questions for that.
No. Yeah, I think because we're at 3:16, we can just pause and see if there's a few more questions that people can think of. I know that, it definitely would be helpful to have the whole tool in front of you, but that's sort of the next step. We wanted to kind of have you do a little pre-work, sit and listen to the tool now, and it looks like a lot of the questions are having you guys, you're wanting to move forward and ready for the whole tool. And I think, as we just talked about, in the scoring and the great discussion that's in the chat box about, could you just have family score and move forward from there? And otherwise, that hopefully you'll see too, once you get the tool in your hot hands, that there's all kinds of customization that can happen. And we are happy to do it, as Beth has just said. Beth, I just want to share with you really quick, while maybe some other people are thinking of questions they have or processing, that in the chat box, I don't know have you looked into it yet? There was just a little bit of discussion following on the scoring, that after you've done the actual scoring of the tool, that there's a discussion for reaching the consensus, not necessarily a consensus reaching of the scoring, but it's a consensus on what the next steps are, correct?
Well, it's both.
Okay.
I mean, I can't see that, but so you can reach consensus before you score the tool. You can score it individually. As someone said, maybe they should just have the families and/or youth leaders score it, and then take that information and discuss like next steps for how to improve family engagement and make it more meaningful for everyone on the team. Does that answer the question?
I think so. Well, it was more discussion, and I may have just paraphrased.
Oh.
It was several people that I may have paraphrased wrong too, but
Wrong
Yeah,
one.
there were a couple of things as far as consideration of different ways to be able to potentially use the scoring tool, even if there were some legitimate differences you wanted to try to call out, or you really wanted to consider the family experience against the professional's experience. You could do the tools side by side, fill one scoring tool out and have the other, and then look at them side by side. So that was in there. And then Clarissa did say if there were legitimate differences, then you may not be able to per se come to consensus on the scoring itself. It may be important to call out the differences and keep those so that you can see if you can make a difference in those, but gain consensus on next steps in towards that end.
Absolutely. Thank you, Clarissa.
Clarissa, I just
Clarissa is on
words
our,
in your
that,
mouth,
is
and
that,
you could have unmuted and said it yourself, I suppose.
and that's Clarissa Hoover, right? Because she's a member of our team
Yes.
that helped us.
Yes.
She was
Correct.
instrumental in this work.
Yep.
Hi, everybody. This is Clarissa. I was just trying to help out a little bit in the chat box while flying below the radar here.
I will call you out every time, Clarissa. Wow.
Very good.
So I will say, Bethlen, if other people have questions, or Kara and Mary Jo too, because they're on your call, we're always available for answering questions, and looking forward to hearing how you use the tool and what was helpful. And hopefully there won't be stuff that wasn't helpful, but again, it informs our learning and improves the tool. So, and thank you very much for this opportunity.
Yeah.
We
Oh my
really
goodness.
appreciate it. And
We are
you
just
have,
as grateful. I'm thinking that it might be a good time for us to consider ending the public portion. We have 10 more minutes, and what that would allow us to do is allow, if there's anyone else that has joined externally of the CMC coin, that if you had any questions you wanted to ask before exiting, and then we'll just take the last few minutes just with our core team that's able to stay on until 3:30 to go over next steps and/or any further questions they might have. So I just wanted to open the floor if there's anyone further that may have anything to ask that's external to CMC Coin. And then we'll just say, really appreciate your being here. We'll drop the evaluation link in one more time for you into the chat box if Libby could do that. And then we'll thank you, Libby. And then we're going to give you a moment to sign off, and we'll continue on with our CMC Coin participants. Oh, that was Ben that did that. Thank you, Ben.
They both
and
did.
Libby, they're both
did.
on it.
and do you need me to stop sharing my screen? Do you have other things you want to put up?
Yes, that would be great. Great. So we'll say goodbye to our anyone was joining the public portion. We appreciate your being on. I'm going to just move into sharing the screen for next steps. And in that context too, I would like to just take a moment to consider if teams had any particular questions they wanted to ask. One of the things we wanted to make sure that you were aware of is that we're going to try to have the baseline FESAT done January 1st. we're looking to do, and in the meantime, obviously get the technical assistance support you need to be able to do that. Mary Jo and Beth, could you share your estimate again of how much time this should take?
So this is Beth, and from the pilot, what we learned is that it actually takes for an individual to complete the FESAT, it takes maybe like a maximum of 10 minutes. So the actual completing the tool is quite fast. If you do it as a group, it will take longer because there will be some discussion. But, and so then it's just, so there will be some time, and I believe that Kara and Mary Jo will be providing expert technical assistance around crafting the description of the initiative, because that is key, because that provides the context for responding to each of the items, like keeping the initiative in mind while you respond to each of the items. It's not, I guess you could use the tool to assess, like if it was a single organization, like say Medicaid, they could use the tool to assess how they engage families across the entire organization. But we know that under the umbrella of organizations, there are many different programs that serve different populations, and they're all working on multiple initiatives to improve access, payment, like benefits, etc. And so it is really critical to keep the specific initiative in mind. And Mary Jo and Kara will be working with, I guess they may, actually I'm going to let them speak for themselves, but my understanding was that Kara has actually already provided some of that assistance to the teams in the crafting of their initiative.
Yeah, a little bit, but we're happy to do whatever else as people process and get the tool in front of them and begin to look at it and think through it. And there is, as Beth Lynn said, that timeline of, we've given you until January 1st. So that's a lot of time, but then, the total time it'll take is just as Beth said, not more than 2 to 3 hours. So we have plenty of time for Mary Jo and Beth and I to help you however you want to put it together and make sure you've got it. Everybody's on the same page, and then, move forward. So that hopefully there's plenty of time, and it's all wonderful, good learnings, even if it's awkward as we kind of move forward in all of it. So,
and I will say 3 hours is on the high side. The only team that took 3 hours, they did it as a dinner meeting. And so I think that, and they admitted that there was a lot of other conversation that went along. But so we actually, that was something that we had the pilot site time each phase of completing the tool. And so total, I think the team that took the longest was like 2.5 hours. Again, there was food involved, but it really shouldn't take more than a couple hours.
Very good. Okay. So a couple of ways that technical assistance could be provided would be, we're going to have an open office hours on Tuesday the 12th. So if you're processing this information and finds that there are further questions that we imagine or we know likely will come up, given that there was just an initial pass through on your plans and initial feedback provided, and every team is different with this, which is very exciting in this coin, but also requires consideration. So we'll have that from 4 to 5, and then they'll be able to also work with you to come up with a more one-on-one technical assistance kind of call with whoever from your team would be good to have on that. So you can also reach out, and I'm happy to help coordinate that. I know sometimes it's easier for people. If you just want to reach out to me, I can get you to the right people. So whatever works. So they'll be doing that as well. And I didn't know if the other question I had was just what your sense of for you all for the timeline of being able to get people out the resources, the package of materials, and for them to be able to work with.
Kara, are you going to work with each team to give them the tool?
Yep. So
okay.
If it's ready for me they're wondering if they can have it before the before the office hours, sorry, Tuesday. So there's not a reason that I wouldn't be able to email it out to everyone this week, correct?
Okay, right. I'll send you the folder
Okay.
as soon as we all hang up.
Yes. So the answer is yes, yes, it is coming this week and before the office hours, so you can look it over. And then if you can't make the office hours, no big deal. You've got my email, Mary Jo's email, Beth's email, or phone numbers or whatever. Just let us know.
Great. Thank you. All right. So just to be aware, I can't see the chat box. Is there anything else that we should address in that before I go through these final few items?
No, we
Okay.
just answered. Yep, thanks.
All right. If there's anything else anyone wants to throw in there, we can always also just answer it after. So if you have any lingering questions that you want to throw into the chat box for us to consider and respond to, and or to then start as the basis for open office hours, we're welcome to do that. So you can see here the monthly state team update is due on November 22nd, and I apologize, but the Thanksgiving holiday is coming up, and I'm sure everyone's in their mind as they're thinking of the baseline FESAT being due on January 1st is also considering holidays. So we'll let you know when that is ready for you as we are adding questions every month at the end to try to gather information from you that are kind of a one-off. So we're going to do that again this month. And then look for an email. We are in the works of getting the in-person meeting set up for next year and for consultation visit scheduling, so we can have that all in order and with plenty of time for everyone to begin their planning and have that in their schedules. And you all know November 1st has come and gone, and we're on to round 2 of survey collection for those families and staff. That goes through April 2020. And as always, we ask that you continue to upload documents for cross-sharing on Box. And as always, please reach out to us for anything and everything that you may have questions about. And we appreciate that your understanding and flexibility as we didn't end up going to breakout rooms, because it seemed more important to be able to continue sharing and answering and clarifying questions. So anything else anyone would like to add before we finish up?
No, Bethlyn, this is Kara, and I just wanted to say thank you for saying that about the breakout rooms. My apologies, guys, that we didn't get to go. I know it's always very helpful and nice to have team time sort of in the moment. And we had planned it, but I hope you found that the questions that were clarifying things were useful as well. And hopefully there'll be more time where we can all work together as a team on this going forward. So thanks for being flexible.
And we are very grateful to Family Voices for allowing us this opportunity, for being here, for this great work that you've presented today. Really, it's just, it's great to see the work, the commitment, and to be able to be a part of that. So thank you very much for all that you've done, for your presentation, particularly for Mary Jo and Beth, for all that work. And for dealing with all the technical difficulties that just love to pop up. We have evaluation here. If you could take a moment, we're dropping that into the chat box again. So you've got that link. It won't take long, I promise. And we'll also send a follow-up as soon as the recording is rendered, so everyone has that. And I think that's about it. So, Meg, any final words? Anyone?
I just wanted to say thanks again to the folks who joined us from the other coins. I hope that this was helpful to them, and we will certainly keep our coin apprised of anything that comes out as a result of their interaction with us. So thank you all very much. Well done.
Excellent. All right, everybody, enjoy the rest of your day, and we appreciate your time. I'm going to leave this open for a moment so that if people wanted to get the survey and whatever they need to do as they're getting ready to head off. So I'm going to leave the webinar open for just a few moments.
Thanks, Bethlyn.
Thank you. All right, everyone. Thanks so much for your time and have a great day. We're going to sign off now.